Excellent, excellent. Hello and welcome to another Rush Generations Health Education Lecture. Today is Wednesday, November 16, 2022. I am Grisel Rodriguez Morales, Manager of Rush Generations Programs, which are brought to you by the Social Work and Community Health Department at Rush University Medical Center in Chicago, Illinois. And today's lecture is Diabetes 101, and we are delighted to have a few of our Rush colleagues joining us to tell us about this condition, especially how to manage it at home, what we call self-management. So how to manage it if you or someone you know has been diagnosed with diabetes or pre-diabetes. And one of our first colleague that's going to be speaking with us today, I'm sorry, I have the slides backwards. So one of our colleagues talking today will be Amy Folker, who joins us from Rush Oak Park Hospital, about 6 miles west of our campus, Rush University Medical Center. A hospital that has a long history of making a difference in the community, thanks to the exceptional healthcare they've been providing for more than a century. Amy is a family nurse practitioner and certified diabetes care and education specialist. Amy works with people living with diabetes to manage that condition through lifestyle measures, including diet, exercise, stress management. And for the past 20 years, Amy has worked with patients living with diabetes at the Center for Diabetes and Endocrine Care at Rush Oak Park Physicians Group in Oak Park, Illinois. Her practice includes working with people who have type 1 diabetes and type 2 diabetes and gestational diabetes. And in addition, she runs the Project Lifestyle Change, which is a grant-sponsored program to help prevent diabetes in those with a pre-diabetes diagnosis. Then we'll hear we'll hear from Janelia Mitchum, who is a clinical social worker and care coordinator with our department, Social Work and Community Health. She is a graduate from the University of Illinois at Urbana-Champaign, and at Rush, she provides clinical care management. She facilitates psychoeducational groups through a senior wellness contract with the city of Chicago, and is a program coordinator for the Health Legacy Program for Women. She is going to tell us more about a support group that we have here at Rush. And later on, we're gonna hear from Dr. Christine Tangney, which she is a professor in the Department of Clinical Nutrition and Preventive Medicine. Dr. Tangney will discuss the US Pointer study, a lifestyle intervention trial to support brain health and prevent cognitive decline. We're delighted to have them again because we like to present about their studies every now and then. So without further ado, what I'm going to do now is then give Amy the slideshow to you. Thank you for joining us. You can go ahead and start sharing your slides right now.
Okay, great. Well, I am glad to be here, and this is so nice that we have this opportunity, all virtual. See if I can get, there we go. So as Grisella was saying, I work with people with diabetes here in the Diabetes Center at Rush Oak Park Hospital. I've been here for a while, and I love to talk to people and give information. A lot of the things that I learn about how to self-manage your diabetes, I learned from what's worked and what hasn't worked for other people that I work with, other people out there living with diabetes. So diabetes is, just like this says, very, very common. If you don't have diabetes, you most likely do know somebody that has diabetes. Diabetes is a chronic disease, and what that really means is it's something that there's no cure for, but it's something that you can live with for your life. And the good news is about diabetes, and one of the reasons I really enjoy working in this area, is diabetes can be managed, it can be controlled, people can have a long, healthy life with it. But it's something that really the people that are living with diabetes really have to take care of themselves and learn a lot about the condition, learn how to control it, because yes, medication plays a part, but really a lot of diabetes management depends on lifestyle. If it's food, exercise, stress, all those things. So I was going to start here just with some statistics. Right now, we're saying that there's 30 million people in the U.S. that have diabetes. And again, that's what I'm saying. If you don't have diabetes, you probably know somebody that does. I started here quite a while ago. I think we said 20 years. But when I was giving presentations to the community like this group, or when I was teaching my diabetes classes, I used to say that 12 million people in the U.S. had diabetes. Now we are up to 30 million. It seems like every few years when the statistics get updated, it just is going up at such a fast rate. And that's one of the real reasons that we also have a program here for people with prediabetes, which means their blood sugars are higher than normal, but not in the diabetes range. And we're working with them to try and help them prevent themselves from being in this group of people with diabetes, because it's just so many people in the U.S. Really the healthcare system has a hard time even, if you've tried to get an appointment with, in a diabetes center or with your doctor, sometimes it's not easy. And again, here you can see the facts about prediabetes, even more people, 84 million is the estimate. And if you're age 65 or older, you probably have about a 50% chance of having prediabetes, because unfortunately, this is one thing, as the older you get, the higher risk you are for having prediabetes or diabetes. So I just want to start out and kind of go over what diabetes is and how do I know if I have diabetes. So like we said, diabetes is a condition that your blood sugars are too high. We all need glucose in our bloodstream. This is really the energy that our cells use to keep functioning. Just like your car wouldn't run without gasoline as its source of fuel, the body cells do not run without glucose available as its source of fuel. So glucose is not a bad thing. It just becomes a problem when the body can't utilize the glucose properly and it starts to build up in the bloodstream. So I'm going to kind of focus more on type 2 diabetes today. There are real differences between type 1 diabetes and type 2 diabetes. Both of them have to do with the body's having trouble using the glucose, but kind of for different reasons. And for today, I'm going to focus on type 2 diabetes, which is really where the body, there's glucose there, and the body's also making insulin, this hormone that helps us utilize glucose. But the cells are resistant to the insulin. So the insulin, this hormone that's responsible for moving the glucose or sugar from the bloodstream into those muscle cells to give you energy to move, or into your brain cells to give you energy to think. We need insulin to move that sugar in. And the cells in people with type 2 diabetes are resistant to that insulin. So they have a hard time processing that glucose and getting it to where they need to go. So how do you know if you have diabetes? Well, there's a few different tests that we can do, all of them related to the blood and looking at how much sugar is in the blood. But one of them that you probably may have heard of, especially if you have diabetes, you've most likely heard of the A1C test. That kind of gives us an average over the past 2 to 3 months, how well the blood sugars have been controlled. And the normal number for that would be for your A1C to be less than 5.7%. Okay, so that would be normal if your blood sugars was in the 4% or 5% range up to 5.7. Now, pre-diabetes, and again, this means your blood sugars are higher than normal, but not in the diabetes range, is if your A1C was measuring in the 5.7 to 6.4 range. And again, if your A1C is in that range, that doesn't mean you have diabetes, but it means, hey, time to maybe look at some lifestyle changes, look at what you're eating, look at how much exercise you're doing, look at your weight if you're overweight, stress also, so that A1C does not continue to rise. Because if the A1C is 6.5 or higher, that is the definition of diabetes. And again, it's a very controllable condition, but we do need to control it. If you're not checking the A1C, and again, this test is usually done in a lab where they draw blood from your arm, or at some doctor's offices, they have a point of care A1C test where they can even just take a drop of blood from your finger and run the test in the office and give you the result right then and there. Another way we can detect if you have diabetes is just to check the blood sugar or blood glucose level. I just want to take a minute. Sometimes I say glucose, sometimes I say sugar, but those are basically, I'm talking about the same thing. So if I accidentally say blood sugar instead of blood glucose, just know I'm talking about those are the same thing. Just two different words to use to describe it. So a normal blood sugar, if you haven't eaten, you're fasting, this is your fasting glucose, you haven't eaten anything in like 4 to 8 hours or more, should really be less than 100. If your fasting blood sugar is in the 100 to 126 range, that's a little bit high, and that's what we have diagnosed as prediabetes. And if your fasting blood sugar is consistently running over 126, again, that is a diagnosis of diabetes. And just so you know, we don't using blood sugar levels, we usually don't just, if it was a 126 once and then all the other times we tested it, it was in the normal range, it was say in the 90s, we really would have to see the blood sugar more than once in that range before we would diagnose you with diabetes. And then the other number that sometimes is looked at is the number of your blood sugar after you've eaten. Because before you eat, that's where your blood sugar is the lowest. After you eat, that's where your blood sugar is the highest. About 1 to 2 hours after you eat, your blood sugar peaks. And again, it will go up even in people that have no diabetes, but it shouldn't go over 140. And if you have diabetes and you haven't been diagnosed, you would have a blood sugar over 200 prior, or just about an hour to 2 hours after eating. So I know these are a lot of numbers, and I don't expect anyone to really remember these, but I just kind of wanted to give you an idea of what you can, ask about if you're asking your doctor, do I have diabetes or not? Or do I have prediabetes? So I said earlier, like, people live with diabetes for many, many years, for their lifelong, and they can, and it doesn't have to be a problem. We also have people that say, well, my blood sugar's been high for more than a year and I feel fine. Why should I, make changes, or why should I take medicine? One of the reasons that diabetes does matter is because it can be kind of like high blood pressure, what some would say is like a silent killer if it's not controlled. Uncontrolled diabetes, high blood sugar levels over, maybe not days, but months and even years, can affect organs throughout your body. So this is just a kind of picture of some of the different areas that the high blood sugar levels can affect. And one of the reasons we want people to control their diabetes if they have it, keep their blood sugars at that normal level, is to prevent complications of diabetes. When you have diabetes, you're 2 to 5 times more likely to have a stroke or a heart attack. So again, keeping those blood sugars under control, keeping the blood pressure under control is going to help reduce your risk for having cardiovascular disease related to your diabetes. Diabetes can affect the eyes. In fact, the #1 cause of blindness in the United States is what we call diabetic retinopathy. So, people that have diabetes, we make sure that they see the eye doctor once a year. Make sure that they get their retinas, the backs of their eyes, checked to make sure that there's no damage from the diabetes back there. Because if they catch things early, they can actually, there's certain treatments that they can do to help preserve the vision. Diabetes that's out of control and isn't taken care of can lead to kidney damage, and even in the worst cases, people can lose their kidney function and end up on dialysis. So again, if you have diabetes, your doctor is going to be doing a urine test once a year to check and make sure that there's no protein spilling in your urine. Those would be one of the first indications that the diabetes is affecting your kidney. So again, really important if you have diabetes to not only control the diabetes, control the blood sugar, control the blood pressure, but go to the doctor so that you can get these annual testing done. Get to the eye doctor to get your eyes looked at, get your kidneys checked. It also affects the reproductive organs of both men and women. So a lot of men with their diabetes left under control can have problems with erectile dysfunction. So it really can damage things throughout the body. And then another common place that people have trouble is if their blood sugars are left too high, they get what we call nerve damage or neuropathy. And this means some people, you may know, they'll say, oh, my feet, they're numb, or they're tingling, or they're burning. Sometimes as the neuropathy gets worse, it becomes very painful. In fact, people are even having to take medications to help with the pain. So again, we want, if you have diabetes, you want to keep those blood sugars in control so that you don't develop these problems. Also, if you have diabetes, you want to make sure that you're following up with your healthcare provider on a regular basis so you can get the tests and some of the protective medicines so that they can be checking your cholesterol, making sure it's not high, checking your blood pressure, giving you medicine for those if you need them, the yearly eye exam, the yearly kidney test. All these are really, really important to prevent damage and delay any complications. Okay, So usually people will ask me, well, if I have diabetes, what should my blood sugars be? And this is a chart that's going to give you, the ADA is the American Diabetes Association, and these are their recommendations. If you're at home checking your blood sugar before you eat, your blood sugar should be in the 70 to 130 range. And again, these are goals for people who have diabetes. If you check your blood sugar 1 to 2 hours after you eat a meal, it should not be over 180. Now, the AACE, or the American Association of Clinical Endocrinologists, they would say it really shouldn't go over 140. They have a little bit more strict guidelines than the ADA. But I think if people are even meeting the ADA guidelines, I think they're doing really well. And then that once every 3 month blood test that we have done, the A1C, to kind of give us an average. The goal for most people is to get that A1C below 7%. Some people that are, younger and are very healthy otherwise, we may encourage them to get it even a little bit lower, below 6.5%. But then again, the goals have kind of changed for older people or people with any type of heart disease. If that's the case, we say the A1C should be under 8%. So it's a little bit, I would talk to your doctor and find out what exactly is my goal. Because again, under 7%, that's really good control of your diabetes. But for some people, it doesn't need to be controlled quite that tightly. And then again, for, some other people who may be younger or, are extremely healthy, we may encourage them to get their A1C even a little tighter controlled to 6.5. So as you can see from that, blood sugars can go up, they can go down, and they do throughout the day. Our blood sugars are changing, every few minutes. If you check your blood sugar, you're going to see a different reading. But we don't want them to go too high or too low. There's probably somebody out there has had a low blood sugar if they have diabetes, and it never feels good. Low blood sugar is if your blood sugar level dropped below 70. And this is a situation that needs to be corrected quite quickly. So our body knows that it needs a certain amount of sugar to keep functioning. And if the blood sugar level drops, our body's going to try and tell us, like, hey, something's going on here, something's wrong. And some of the more common symptoms are people will feel shaky, they'll feel sweaty, they'll feel hot, they'll be sometimes they'll feel their heart pounding in their chest. They may become really irritable or nervous, kind of like from those old Snickers commercials where they were talking about people being hangry. That is actually a sign of low blood sugar, feeling really hungry, tingling of the lips. These can all be signs of low blood sugar. If the blood sugar becomes too low, people can actually pass out and from the low blood sugars. So it's important, if you have diabetes, that you know these symptoms of low blood sugar. So if you start getting the symptoms, what are you going to do? What we want to do is, number one, check your blood sugar. If you're having the symptoms and you have your meter there with you, check your blood sugar. Is it below 70? If you don't have your meter with you and you're having these symptoms, I think probably safest to just assume that it's a low blood sugar, take what we consider a fast-acting carbohydrate, something that's all sugar to boost up your blood sugar. Some examples of this are a half a cup of juice, half a cup of regular soda, not diet, You can buy glucose tabs in the store. If you are using glucose tabs, it's 3 or 4 of them. It's not just one. Also, like hard candies, like Smarties or Sweet Tarts, like those are usually good. Or a handful of jelly beans. It doesn't have to be the whole bag. Just a small handful is probably enough. What you want is equal to 15 grams of carbs. So again, that would be the amount of sugar that's in a half a cup of juice or half a cup of regular soda. And then you won't feel better right away. If you have a low blood sugar and you drink 4 ounces of, say, apple juice, do that and then sit down, check the clock. It's going to take about 15 minutes before you're feeling better. After 15 minutes, we really want you to recheck your blood sugar. Is your blood sugar up over 70? If it's still below 70, you need to repeat that. Another half a cup of juice or another half a can of soda or another, handful of gummy bears or Sweet Tarts. Again, wait the 15 minutes and then recheck. Once you do get your blood sugar up, you're kind of not done treating it. At that point, I want you to think about like, hey, when's my next meal? If it's time to eat, go ahead and get your, meal and eat. But say this happens at 1:30 in the afternoon and you're not planning to eat again until, say, 4 or 5 o'clock tonight. If it's going to be more than an hour or so, I want you to get yourself a snack to hold you over. So something like, maybe like 5 or 6 crackers with cheese on them, or 5 or 6 crackers with peanut butter, or a half a sandwich. Something that's got a little bit of protein and a little fat in it, in addition to a little bit of carb, just to kind of hold you over and to replenish the lost carbohydrates. So I just wanted to go back to why you might get a low blood sugar. Because again, I think it's really important because we're trying to encourage people to, really take care of their diabetes. A lot of it happens at home. So if you have a low blood sugar, you might want to think, okay, what could have caused this? Because you want to prevent it from happening again. And just so you guys are aware, some of the common causes of hypoglycemia, maybe you took too much medicine. If it was insulin or your pills for your diabetes, maybe you accidentally took them twice or took too much. That can happen. Maybe you missed a meal. Not all of the diabetes medicines today do you have to eat at specific times, but some of them you do. So if you missed a meal or you didn't eat as much as you thought, some people that are taking insulin base their insulin on how much food they're eating, and maybe they didn't eat as much as they expected. That can cause it. One thing, physical activity. If one day you're maybe more active than you are on a usual day, even just getting out there and doing yard work, or you're doing more shopping, like the holidays are coming up and you're in the grocery store walking a lot more to try and, get everything together. That can all cause the blood sugars to go down. So, if that's a problem for you, that, when I get more active, I can sometimes get a low blood sugar. That means you need to keep something with you, either in your purse or your pocket or somewhere, little bag, when you're out, in case you had a low blood sugar, so you have something to treat it with. And then sometimes when people are sick, that it can actually cause high and low blood sugar. So if you're not feeling well, you're sick, keep a close eye on your blood sugars, because sometimes they can drop. Okay, and then the other extreme is if your blood sugars are running too high. And again, if you have diabetes, I want you to take a look at these lists of symptoms, because if all of a sudden you're thinking, wow, I need to get to the eye doctor, my blood sugar or my eyes have been blurry. I'm having a hard time reading where I used to not. Or you're feeling really tired and fatigued all the time. Or you're really thirsty, you're drinking more than usual, and then you're not only drinking more than usual, but then it's making you run to the washroom, you're urinating more than usual. Any of these new or worsening confusion, any of these can be signs that the blood sugar is high. If you're having these symptoms, get that meter out and check your blood sugar. Some of the, you might want to think, like, if you checked your blood sugar and say you saw a really high number, it was, 250 or 300 even, you might want to think like, oh, did I take my medicine today? Maybe you missed your medicine. Or, maybe your blood sugar is high, but you were just out at a birthday party or, out to eat with some friends and you ate more than usual. Sometimes even that can happen. Or if you're, used to being a certain amount of activity per day and then all of a sudden you haven't been doing that, your blood sugars may be a little higher. And then, again, just like I said before, being sick, even a cold or a urinary tract infection, the flu, sometimes just even the littlest change in your health can cause the blood sugars to rise. And then also down in the screen bar here under medical conditions, one thing I would point out, stress can really increase your blood sugars. So if all of a sudden you found yourself in a stressful time in your life, something's going on, and honestly, even around the holidays are coming up, it can be stressful for people. And people tell me all the time, like, oh, my blood sugars are higher this past week because, been having, I've been really stressed over maybe your friend or family's been sick and you've been having to help them, or something changed at your job, or, all kinds of things. And then certain medications can increase blood sugar. And one of the ones I do like to point out is steroids, such as like prednisone, or can increase your blood sugar. So if you were started on some of these medicines for another condition, you may see your blood sugar rise. And again, if that's happening, let your doctor know. So if you do have high blood sugars, kind of try and figure out, is it something, that I can correct? Like, did I skip medicine, or maybe it's just because I ate more? Drink plenty of water when your blood sugar is high. That will help to help, bring down that blood sugar. If your blood sugars are consistently running over 250, we really do recommend that you call your healthcare provider and let them know that. So that they can maybe, help, adjust your medicine or follow up and see what needs to be done to help bring that down. And then finally, one other little tip I like to remind people is, if you tested your blood sugar and it all of a sudden gives you a really high reading, and you're like, I just have no idea why my blood sugar could be high. Nothing was different with my medicine or my food. I always do remind people, those meters aren't perfect. I tell people, go wash your hands, dry your hands, and test it again. Sometimes the meter just gave you a reading that was off, or sometimes if, say, you were preparing your food, if you're preparing your food and you have some like food residue, you were cutting up some oranges or something, or fruit, that can actually register in the meter and give you a false high reading. So if you're getting a number that doesn't seem right, always verify it. Okay. So there's lots we can do to treat our diabetes. Of course, there's medications, and many people do need one or multiple medications to keep their diabetes under control. But regardless of if you're on medication or not for your diabetes, some of these lifestyle changes are really important. Like we were talking about before, diet and exercise, that really can affect your blood sugar levels. If the more carbohydrates you eat, the higher your blood sugars are going to be. Exercise, on the other hand, that helps lower your blood sugar. So even going out for a walk after your meal will help your body utilize that glucose better. Weight loss, if you're overweight, losing weight will help control your diabetes. Like I talked about right in the beginning, type 2 diabetes is where you make insulin, but your body is resistant to it. So the insulin can't do its job of helping get that sugar from the bloodstream into those cells that need it. But one way that we can make ourselves more sensitive to our own insulin again is to lose weight if we're overweight. Also monitoring, so you can figure out, okay, when I do this, my blood sugars are really good, or when I do this, my blood sugars are higher. So you kind of have to do your own research on yourself. This is one of the reasons that we really do encourage people to test their blood sugar 2 hours after a meal, because you can kind of see, oh, when I have, say, my chicken and broccoli and rice, my blood sugar goes up a little bit. Oh, well, if I have this big bowl of pasta, I'm at Maggiano's, and then my blood sugar goes up a lot. So you can kind of figure out which foods keep your blood sugar where you want it, which foods make it go up a little too high. And actually, you'll probably be surprised. Some of the things you think, oh, I can't eat this because my blood sugar will go too high, may not cause that. Or, some of the ones that you think are, really healthy and good, and they do cause blood sugars to rise. So it's, kind of individual. So you kind of have to do that checking and figuring out for yourself what works and what doesn't work. And then finally, stress management. We don't have any, we have no magic pill to get rid of stress. It's really something, I know there's a lot more out there. There's some even good apps on the phone that help with, stress management, some like relaxation things, exercise, that's a good stress management. I'm sure that Grisella could get a whole talk just on stress management if she hasn't done one of those for this group before, because that's a great area to look at. So I know that's a lot, and we have such short time here, and there was a lot to cover, but I do want to just go into very briefly about food. I know a lot of people have questions about diet, and we can talk about a little of those at the question and answer. But one of the things that we like to encourage people here in the Diabetes Center is to really follow what we call the plate method. That means if you take your plate and cut it in half of your plate at each meal should be non-starchy vegetables. Those are the salads and the carrots and the cucumbers and the broccoli and the asparagus and cauliflower. There's so many good vegetables out there. It's basically all the vegetables except for potato, peas, and corn. Unfortunately, those count in the carb corner of your plate. So, but, get the salads, there's all kinds of vegetables out there that maybe we don't try that we need to. Maybe you've never worked with, eating mushrooms or bok choy or, beets or, it's good to try new vegetables and see what you like. And then on the other half of the plate, we kind of cut that in half. So a quarter of your plate should have your protein on it. It is really important to have your meal balanced, to have some carbs, some protein, and a little bit of fat at every meal. So you do want to make sure you get some type of lean protein at each meal. The chicken and turkey are good lean proteins. Fish, really excellent. In addition to being a lean protein, it's got omega-3 fatty acids. Those are super healthy. There are lean cuts of beef and pork even that are that are, good, healthy choices. If you don't eat meat, there still are proteins out there. Some people will eat tofu. Beans have a lot of protein in them, so you can use that as your protein. But get some protein with every meal. And then you also have this, what we like to call the carb corner, or that quarter of the plate that you're going to put your carbs. And those are your breads or your rice or your potato or your pasta. Those all count as your carbs. So again, it's not that you can't eat, rice or pasta or potatoes. It's just how much of it, and making sure that you always include a protein and some vegetables with it. We do encourage people to keep their liquids or drinks to 0-calorie ones. So water is always best. But some people want to, have a little bit of flavor. One of the nice things is there's a lot of flavored waters out there, and even some like very low calorie, like flavored drinks like Crystal Light and even diet sodas in moderation. I think we have to be a little careful with the artificial sweeteners. It's okay in terms of your diabetes to use those. But I think that, again, in moderation, it's probably not healthy to be drinking a 6-pack of Diet Coke every day. Just, make sure you get enough water in there. And coffee and tea, those are fine also. Careful if you're putting any kind of sweetener in them. Sugar, that is a carbohydrate, but also some of the other things like honey in your tea or agave, those are all glucose also. So you just need to be really careful with that. If you are adding a little bit of sweetness, just really careful to add only a little bit. And then fruits are carbohydrates. A lot of people don't think about that, but and again, I'm not saying fruits aren't healthy, but if you have diabetes, you just have to be careful with the portion size, how many grapes you eat, or how large of an apple it is. Again, there's nothing wrong with fruits. It's just you do need to be careful with the portions of them. Reading labels is really good. One thing I like to point out when I talk about the labels is we want to be looking at that line towards the bottom that says total carbohydrates. All the carbohydrates, not just the sugar, are going to turn into glucose in your bloodstream. And then the other thing is just be careful. Look at the serving size. This is 22 grams of carbohydrate in 8 crackers. If you have 12 or 16 crackers, it's no longer 22 grams of carbohydrate. If you're having 12 crackers, it's 1.5 servings, so it'd be 33 grams of carbohydrate. And if you're having, 16 crackers, that's 2 servings, so it's 44 grams of carbohydrate. A lot of people will ask me, how many carbs should I have per meal? And again, it's great to work with a dietitian so that they can really individualize that for you, depending on, like how tall you are and, if you need to gain weight or lose weight or maintain weight. But in general, if you're keeping your carbs around 45 grams per meal, that's probably a good thing to aim for, about 45 grams of carb total per meal. Okay. I don't know if you can see this it's a little bit covered on my screen, but it's one of my jokes. This guy who's at the doctor said, fitness experts say your muscles need plenty of rest between workouts. And the doctor says, but your last workout was 17 years ago. So yes, exercise is good. It's good for so many things, diabetes and blood sugar control being just one of those things that it's so good for. We encourage everybody to exercise. or do some kind of activity every day if they can. The goal is really to get up to 150 minutes per week. That's 30 minutes 5 times a week, or maybe you do a little bit less, but every day. That, you know, that's really good. But that's a good goal to set. But I mean, that's a pretty lofty goal. 150 minutes of exercise is quite a bit. So, you know, wherever you're at, start there and just try and do a little bit more. Try and do a little something every day. So really, like I said, reasonable goals. You know, you're not going to change everything at once. And if you try to, it becomes frustrating. But pick something you really want to work on. If it's, you know, changing something, you know, you don't want to drink juice or soda anymore because, you know, that's got a lot of sugars in it. Or if it's that you're going to start eating, making sure that you have a vegetable at every meal. Pick a goal and work on it. Again, exercising 150 minutes a week is great. But even if you're not doing that, and even if you can't get up and walk, I mean, even some of these sitting exercises, just even some housework or getting up and moving around. People that sit a lot for work, we say sitting is the new smoking, because if people that are sitting all day, it's really not healthy for them. So we tell people get up every hour, just walk around a little bit. And I am a big proponent of monitoring your success. If that means tracking your food or tracking your exercise or tracking your blood sugars, I think it all really helps to kind of keep you on track, see what things are working, see what things aren't working, keeps you accountable to yourself. So set some goals and monitor it. So I think that I need to wrap this up, and I hope that a little bit of this has been helpful to you. And I think I might have a few minutes for questions.
Yes, indeed. Thank you so much, Amy. Let's Janelia, if you could help us with the slides. But in the meantime, thank you so much, Amy, for joining us.
Sharing.
For joining us today and for covering a good number of key factors, not only to keep diabetes well managed or under control, as you said, but also as a result to have a good life, right? Even after such a diagnosis. So I like that framework. And yeah, I got a kick out of that cartoon. Yeah, it's okay to take breaks between workouts, but not years or months, right? So,
exactly.
In terms of questions, and I'm watching the time, we'll get you out of here just in time. But there's 3 questions that we would like to go over. The tingling or the numbness that you mentioned, I don't know if you were as specific as saying it's in the legs or toes. What if that happens when the person has not been diagnosed with diabetes? Is that a sign that you may be pre-diabetic or diabetic?
Well, I guess it could be, but there are a lot of other things that can cause numbness or tingling in the hands or feet. The diabetic neuropathy is just one of them. It can happen if the blood sugars are really high, even in the short term, and usually that does get better once the blood sugars get under control. But there are a lot of other things that can cause that. So if you don't have diabetes and you're having some numbness or tingling in your hands or feet, you really should contact your doctor or nurse practitioner or your healthcare provider to find out.
Good. And then you mentioned medications that can increase your blood sugar level. We know now that there are over-the-counter medications like cold medicines, pain medicines that indicate is for people with diabetes. And the question is, should we assume that these indeed won't increase blood sugar?
I don't want to speak for all medications that are out there over the counter. And yes, some of them will say, if you have diabetes, check with your healthcare provider before taking these. And I would heed that advice. And just alone, being sick, as we were talking about, that can sometimes cause the blood sugars to rise. So, you know, if you are not feeling your best, if you're not feeling well, monitor your blood sugar if you have diabetes. If the blood sugars are going up, definitely give a call to your, you know, your healthcare provider.
All right. A new question that just came in. What is the best type of sugar to use if you are diabetic?
I'm not sure if they're talking about like a sugar to cook with or to put in their coffee or tea, but I really believe in using whole ingredients and using not a lot of the artificial types of products. So I would say if you are wanting to put a little bit of sugar in some foods that you're cooking, you can, you know, do that, but cut back on the amounts, or, you know, really control the portion of that you're eating. If you want to put the sugar into your tea or your coffee, if you want to use an artificial sweetener, we do recommend stevia, only because it comes from a more natural place. And again, it's not that you can't use artificial sweeteners, but I probably would prefer stevia and stevia. And it's just really the amount of it, not to, you know, go crazy and use it all day.
Of course, of course. Okay, and then lastly, I mean, knowing that you kind of did this at the end, but when you put everything together, it's absolutely the message that the condition can be well managed, it can be controlled, the medications play a role, but there are other steps that people must take for this condition to be well managed, which include the physical activity, the healthy diets, reading labels, which many people sometimes forget to do, and it's as simple as just turning that package around and taking a look at that, and the stress management. And you're absolutely right. We every now and then have focused specifically on stress management in lectures. At least once a year, we cover stress management or stress specifically, especially the chronic stress, because then it can lead to other things like severe anxiety or depression or things like that. But thank you for covering all of those aspects. Anything at the end, since you are there very close to us, making sure that people monitor these conditions well, some last minute words from you?
No, I think you did a good job wrapping that up. And yes, I mean, please be proactive when you go to see your healthcare provider. Ask any question you have. Ask, can I go and see a diabetes educator? They're out there. They're at Rush downtown. They're out here at Rush Oak Park. And they really can help, not just with the food, you know, putting together, you know, meal plans, but also if you do need help with blood glucose monitoring, and now there's a lot of these continuous glucose monitors that people are wearing, or if you're starting a new medication and maybe need help with that, they're here to help you. But you reach out, ask for a referral. You got to be your own advocate these days with so much.
I love that. The proactive aspect is something that we also cover for all of you Rush Generations members or people watching. There's these evidence-based programs as well called diabetes self-management. Here in Illinois, take charge of your diabetes, or Tomando Control de su Diabetes, if it's in Spanish. But it's to make sure that people are getting additional instruction and increasing their confidence in how to move in a way that doesn't affect your life, in a way that is helpful to you to control the diabetes, proper food care, and the communication. You mentioned something that people at times have trouble with, like asking questions or not volunteering that, you know what, I didn't understand that. So can you repeat it? So effective communication with providers is so key.
Good point. Yeah.
And I'm glad you mentioned that. So it's something that is covered during those self-management workshops as well. So thank you so much, Amy. We greatly appreciate it.
Yes, and I'm sure I'll be back in touch with you guys, and I'm sure Grisela could get anybody information if they need it. So thank you all.
Thank you. And then with that, I'm going to invite then our colleague, Denelia Mitchum, who manage also, she is one of the facilitators of those workshops that I mentioned before. And also the facilitator of a support group, which we normally have, usually people participate in that one after they have participated in the diabetes self-management workshops. So let me pull that for you, Denelia.
Thank you.
The slide. Yep, I have it. There you go.
Thank you, Griselle. And thank you, Amy, for all of that wonderful information. It's always nice to hear the latest updates on diabetes. So thank you so much for sharing that information. And as Amy mentioned, a lot of the information that was shared can be overwhelming. You may receive a diagnosis and you're like, what do I do now? Changing my eating habits, that's going to be hard for me. I've been eating like this forever, or I don't have time to exercise. I don't know much about medications. Where do I start? So that's why we have the diabetes support and education group at Rush. So it's a monthly support group. It's very informal, and throughout the support group, we talk about resources and ideas related to managing your diabetes, the ups and downs with managing the diabetes, working with others who have experience or know someone who is living with diabetes. We know that research shows that managing diabetes can be overwhelming, and a lot of times people who have diabetes also have other chronic conditions, and life continues to go on. So one thing we talk about in the group is, just because there's a diagnosis of diabetes, everything else doesn't stop for you, so that you can take care of your diabetes. So how can we continue to manage our diabetes through our everyday life? So we talk about stress. Advocacy is very huge, as Amy mentioned. So being a self-advocate, whether that's medication, whether that's treatment, exercise, all of those management tools, as well as action planning. How can I be successful with my goals? We want you to be accountable. So these are some of the things that we also talk about and create within the diabetes support group. So if anyone is interested in attending, you would like more information, you can give us a call at 800-757-0202. Registration is required. You can also just give me a call. You can reach me there at that number. If you just like to hear more about the support group, or if you have any specific questions, but we would love to see you again the third Thursday of every month, and that's from 2 p.m. to 3 p.m. and that is on Zoom. So from the comfort of your home.
Excellent. Thank you so much, Danilia. You know, can you say a little bit more about the action planning? I think that people don't, you know, we are so used to the concept, and sometimes people may feel like, oh, I'm gonna go to that group to plan for what, and then have homework, but it's a great tool and a great technique to master.
Absolutely. So we have action plans. So as Amy is stated, you may have a goal that you're trying to reach. So what we do is make sure that goal is achievable. It's something that's in your reach that you can do. We make sure you have the confidence to do it. And then we make sure you have the plan as well, because a lot of times we don't have the plan behind the action, and then it causes us to fail. So we want you to be successful in that plan. So together as a group, we discuss what's important to you. So maybe this month you want to, exercise a little more. Well, for me, I'm going to push you to give me a little more. So what does that look like for you? Is that walking to your mailbox? Is that, parking away from the grocery store, walking around in the mall? How many minutes are you going to walk? How many days are you going to commit to? So that's what we do. We go through all of that so that you can have a solid plan to achieve your action.
And to know the progress by measuring, right? If if it's
Absolutely.
3 days, then oh, I did 4 or I did 3. It's good. So
yes, and for you
good.
to see the progress, because that's also important within managing your diabetes. Some things may be out of your control, but some things we can work on controlling. So those things you can control, we like to monitor the progress as well.
Awesome. Thank you so much. Yes, call us, and we will tell you a little bit more again at the end. But now I'm going to have our colleague, Dr. Christy Tangney, and let's see, she's going to talk to us about the Pointer study. We don't see your video.
All right. How about now?
We can hear you, but we cannot see you. But we see the slides. All right, okay. Go ahead.
Okay, great. Let me, I'll try to be very brief, but this is a perfect segue because Amy talks so much about diet, and I think that is an excellent. So do you see my screen full right now?
Yes. Well, not full. We see the slides, but you can start the slideshow at the bottom. Perfect.
I'm trying to do that. Okay, but anyway, let me move on. So, because so many of us are very concerned about the future with regard to Alzheimer's disease, and because when individuals have other chronic diseases, in many cases, it enhances the likelihood that those individuals may be more susceptible to things like Alzheimer's disease or other cognitive disorders. It's really important that we understand the kinds of things that we can do to be healthier and protect ourselves against these things. And what has been really wonderful in this area is that despite all the big trials looking at various medications, really, we haven't been all that successful, but there has been some very interesting information about lifestyle. So Amy and Daniela just talked about some strategies to use. And I think US Pointer is a study or a trial in which you get a lot of these tools.
So Let me just make sure. Can you press again the slideshow?
Oh, sorry.
Let's see.
Okay, let's see.
We're seeing the slides, but not as a slideshow. Go ahead.
Wait a moment, let's see if I can make this happen. Hold it. Does that look like slideshow now?
No, just the slides.
Oh, I'm so sorry. Wait a
That's
Okay.
okay. We see them at least, not as a slideshow, but go ahead.
Okay, sorry about that. So I think the next thing that's really most important here is understanding who might qualify for this. So we're really looking at individuals who are between 60 and 79 years of age, and the risk factors put them at a greater risk for cognitive decline. So we want to get those individuals to join if they're interested. And so those kinds of things are some of the same things that we just talked about a little while ago, that you have high blood glucose or blood sugar, that you have high blood pressure, or you have high cholesterol. If you have family history of Alzheimer's disease, all of those things. And again, once again, one of the major things that we emphasize in almost all chronic diseases is poor diet and sedentary behaviors. So the more you sit, the more your risk is enhanced. And so one of the things that this trial tries to do is give people tools to, and a little support to achieve a healthier, more active lifestyle. So let me move on to this. And the reason why I'm talking to you today is also because we're currently about to recruit in two primary areas, and those areas are around Rush and Rush Oak Park. We are specifically recruiting in Oak Park and Oak Lawn. And Chicagoland is one of the 5 sites where this occurs. And our goal is to hit or enroll at least 2,000 individuals. Right now, we are almost at 1,800 individuals, so we're really, really close. And we, at our particular site, we're at 388. So we will definitely reach our goals, but we want to make sure everyone in Chicagoland has the opportunity to participate if they would qualify. So what happens is they get randomly assigned to either a structured group where there's a lot of intensive support, or a self-guided group. And they're part of the study for 2 years. And one of the things that you learn more about are all these things: physical activity, healthy diet, opportunities to meet with a group. So everything that's done in this particular trial is in your neighborhood and with other individuals who have similar potential risk factors, who have qualified to enroll in the study. And so what we think is a lot of times, a lot of people make new friends. And in fact, the first Oak Park group, which was recruited in nearly 2 years ago, they continue to meet well beyond the study, because many of them have become friends after meeting so many times as a group. So this is a real win-win for most people, especially as many people will move into retirement potentially at this point, and creating a new local relationships is really important. So as I said, we did go to Oak Park. We're going back to Oak Park again because we anticipate some people will age in. We've been in Des Plaines. We've been in a number of the areas. We're at West Pullman, but now currently we're in Evanston, Skokie, but we're going to go into Oak Lawn as well. So if you live near Oak Lawn or Oak Park, you might be interested in following up into this study. I can tell you there are other voluntary studies that once you're in the parent study, you can join. Totally voluntary, totally if you want, but it gives you an opportunity for additional money as well as contributing to science. One is about, as you can see on the left, where we actually image your brain and see what kinds of changes occur over time, whether or not you're in the structured group or in the self-guided group. On the right-hand side here, I tell you the ZZZ. We actually monitor your sleep habits, which is fascinating as far as I'm concerned, and it's done periodically through the study. We also measure the tone and health of your blood vessels if you join the neurovascular. And then there's another arm or another component in which you specifically, we measure components in your stool, and you never have to come into the clinic for that. It's sent to your home. So these are all things that are making it easy for people to participate. I'm going to end here just to say that if you're interested in any of this, these are the contact persons we can reach. You can either call at Rush, and again, this is at Oak Park, that's why it's the 708 number, or you can email us, or you can also call or email us at Advocate. So both medical centers are involved in this recruitment process, and we're excited that you might be interested in joining. I'm going to stop right there. I try to be as brief as possible, and I would be happy to answer any questions. I do have one response, Giselle, to one of the earlier questions about the tingling. The tingling with hands and feet are often a response to insufficient B12. So as we get older, we don't absorb B12 as efficiently. And that's one of the few times that nutritionists will ever recommend a supplement for older adults, because once we get past 50 years of age, our gut doesn't do as good a job of absorbing B12. And so some people will take B12. Not everyone needs to, and that's something that should be checked with your physician or nurse practitioner. But that's one thing that should be considered as a possibility, because that tingling and loss of sensation is very common in clinical B12 deficiency. Okay.
Thank you for that. Yeah, that's interesting. So that will make sure to consult with your physician, or to your healthcare provider, but also maybe start taking that supplement.
Right.
But thank you so much, Dr. Cagney, for letting us know a little bit more, always willing to join us about and tell us more about this multi-center randomized clinical trial.
Right.
The importance of physical activity, keeping our minds active, socially interacting with others, for us to be healthy and avoid any memory issues.
Exactly.
So again, the criteria, if you don't mind going back.
Oh, no, that's fine. And let me try to reshare so that we can see it a little larger here. Again, maybe that will work.
Fine.
Right here. Okay, so let me go. The criteria are here. Let's move it to it. Is that better?
It seems to be stuck in one slide. That talks about the goals of this study.
All right, we go again. Let's try it again. It may be smaller, but let's see. It seems like one of my screens is not working really well. But these
perfect. It's right there. Yes, okay, 60 to 79 years old.
Right.
Okay.
And those additional things, when there's a screening process, when they call in or when they go on the web, that's both those things are possible. And we check to make sure, obviously people already have memory problems. That's not really for you at this point. It's for people who don't have any cognitive impairment, because we're going to measure change in cognition. But these are the criteria, and generally, if you're not a regular exerciser, that really puts you in the criteria. And what we do is it's like a point system. So you get additional points for every risk factor you present. So anyone who has 2 or more risk factors, if you will, is much more likely to be eligible for the study. And those include these things here. As you can see, one of the last ones I list lives in the intervention region. It's not that you can't live outside of it, but because the team meetings are quite regular, especially in the beginning, it would make it harder for people to meet all those things, especially in the winter here in Chicago. So we try to meet participants where they live. That's the goal here.
That always works. That's usually how we do it too. We
That's
are
good.
delighted to be doing this virtually, but slowly but surely we're going also back in the community and offering our programs there as well. And it's beautiful because then we can offer a menu of options. You can do it in person or online, but yeah, absolutely. Being where the people are needing the program is the best way. So thank you so much. So
All right.
with that, everyone, let's go ahead and review our upcoming programs. Let's see.
I can stop sharing if you'd like me to. Yeah.
Oh, great. Thank you so much. Let's see. Here we are. So we continue working and planning and delivering great programming to you. And as a result, let me tell you about these upcoming programs. This one started just last week, but there's still some chance for people with chronic pain to join. This is an evidence-based program that even though if the participants join about a week or two after it started, it provides the same benefits because there's some type of repetition, and it has just been proven to be very effective. This one is in Spanish, so if you know of someone that is suffering from chronic pain, that is dealing with chronic pain, which in itself can be so isolating, this is a great workshop for them. Let them know, and someone in bilingual will reach out to tell them more about the program. There's only a few more days for someone to join. And if not now, we'll make sure we actually have another one coming in the winter, and it's going to be virtual as well. We also offer evidence-based programs that are related to fall prevention, and A Matter of Balance is one that not only provides a great deal of information about how to increase your body balance, your strength, to avoid falls, and other techniques to avoid falls, but also works with cognition, with some type of thought restructuring. What happens, what the creators of this or the developers of this evidence-based program, they have seen that individuals, once they fall once or maybe even more than once, they start avoiding physical activity because then there's some worry, some concern, some anxiety about falling again. So there's some cognitive work that is done through this wonderful program. Again, there's one coming up in January. We are recruiting right now. Please feel free to give us a call at 1-800-757-0202 to register. And this is the program that Danelia let us know about, a little bit more about the Diabetes Education and Support Group. Feel free to give us a call at 1-800-757-0202. Then we have a support group for friends and families of people with memory loss. This program is currently meeting via phone. However, just 2 days ago, here at Rush, some of the active participants from this group, they met in person as well. They've been wanting to meet in person for a long time, and now we're making it happen. And actually, it's this is the first program in which we are having people in person and then also join via phone. It worked really well. So please give us a call if you're interested in more information about this hybrid option, or if you would like to participate for the first time. Then same number, 1-800-757-0202. And with social isolation being so rampant, globally, we created a program that is called the Senior Connections Friendly Caller Program, in which we have trained volunteers making a friendly call, a regular friendly call to older adults. So if you know of someone that is feeling quite lonely quite frequently or facing social isolation, feel free to give us a call and refer the person or tell us about that, or give the number to that person so that they can call us and we can assign them to a friendly caller. The program, the Rush Caring for Caregivers, we have great licensed clinical social workers actually offering this intervention, education and support for those caring for people that are age 65 and older. So if you are in that group, or if you know of someone that may benefit from this intervention, please give them this number, the 312-563-0350, or the 1-800-757-0202 will work as well. We are making sure that anyone requiring any type of service get to the right provider. So we will connect you with our colleagues in the Rush Caring for Caregivers programs. Then we have a great volunteering opportunity. This is going to be the 6th or 7th year in which we are having adults with chronic health conditions volunteer with Rush University students. So these are students from 19 different disciplines, because here at Rush University, we have 17 different disciplines, but we also have social work students and pharmacy students from other colleges and universities who come to Rush to be trained in interprofessional person-centered collaborative practice. It's the best way to practice so that we get to greater outcomes. So all of our students take this course, and one piece which happens between January and March is for the students to work with someone in the community very early on. These future healthcare providers or professionals learn that care doesn't stop in the clinic, that factors at home and in neighborhoods and in communities also facilitate or hinder the effective care or the effective management of chronic health conditions. So our community health mentors are a great tool for them to understand this before they graduate and practice. So again, you can call us at 1-800-757-0202 if you know of someone who may want to volunteer, or you can email us at IPE, that stands for Interprofessional Education, IPE@rush.edu. And always, we are here. We want to learn from you. We want to hear your feedback. We want to also know about what is important to you, what matters most to you. So you can go to the aging.rush.edu website to access our Shaman Senior Voices platform, but also you can point to that barcode or QR code, and it will take you to the website so that you can record a video to let us, not only us, but also even you get a copy of the recording so that you can share it with family or healthcare providers. Our next lecture is coming up, is Vision Health. We listened to you. Many people wrote indicating that was an important topic as well. And on December 7th, we'll have Vision Health. We have one of our colleagues here at Rush doing this lecture for us. So until then, we'll see you, and feel free to give us a call, 1-800-757-0202. Thank you, everyone.